Meet Mr. Awesome. Mr. Awesome is 48 years old and has been a diabetic patient for the past 15 years. As a part of his diabetes management, he has been taking Glimepiride 4 mg daily from the last 10 years. Since 1 year, he had 2 episodes of severe hypoglycemia. Moreover, his HbA1c levels have raised in the last 6 months from 7.4 to 7.9. Mr. Awesome felt a serious concern over his increased HbA1c levels recently and thought that he should do something for it. So he decides to visit a local endocrinologist and resolve this concern. The doctor checked his history, and to achieve the goals of HbA1c reduction, he added basal insulin to his treatment regimen along with Glimepiride. After the doctor's visit, Mr. Awesome started taking glucose log daily. As per his handwritten glucose log, various readings as low as 50 to 60 mg were seen, which was indicative of hypoglycemia. Let's see what happened 1 month later after the start of this combination therapy. One day, while going to his office, Mr. Awesome was observed driving at 90 miles per hour. Quite fast, isn't it? He was having anxiety and nervousness while driving, so was unable to concentrate. Suddenly, he started driving in a wrong direction on a residential street. He tried to control his nervousness, but after swerving to miss several cars, he ultimately lost his control. And bang! His car hit the tree, and Mr. Awesome got severely injured. Now we will have to see what actually went wrong in Mr. Awesome's case. What do you think about that? Yes, you are absolutely right. The major cause of Mr. Awesome's accident was nervousness and confusion due to hypoglycemia. Let's have a look on some reasons that lead to hypoglycemia in Mr. Awesome's case. Spontaneous hypoglycemia is uncommon in non-diabetic population, but in case of diabetic patients, it's the primary barrier in optimum glycemic control. In patients with diabetes type 2, medication like Glimepiride can cause the release of insulin glucose-independent manner that results in hypoglycemia. This mainly occurs due to dysfunctional counter-regulatory communication between glucagon-producing alpha cells and insulin-producing beta cells, which increases the risk of hypoglycemia. Considering multiple treatment options of oral antidiabetics, let's see which of them has the highest risk of hypoglycemia. Let's see what you think. Yes, hypoglycemia is most common with sulfonylureas. As you can see in this graph, that all major drugs from this class have a high risk of hypoglycemia. And you can see that Glimepiride has 11% incidence of hypoglycemia, as happened in the case of Mr. Awesome. Now let's see what can be done to prevent hypoglycemia in patients like Mr. Awesome. It's time for you to decide. You are right. As you can see in these graphs, Vildagliptin metformin treatment had a favorable hypoglycemic profile compared to the treatment with Glimepiride metformin with least incidence of hypoglycemia, minimum number of hypoglycemic events, and no severe events at all. Thus, we can conclude that Vildagliptin treatment group provided very low risk of hypoglycemia compared to Glimepiride group. Similarly, adding basal insulin with Vildagliptin leads to sustained reduction in HbA1c, the dose and number of insulin injections, and risk of hypoglycemia. So, in patients like Mr. Awesome, where basal insulin is required, Vildagliptin as an add-on therapy is the most favorable option. Coming to the major need in this case, let's see what you have assessed. Yes, the main issue which was raised was HbA1c from the last 6 months. For that, one of the best treatment options to reduce HbA1c levels over time with low risk of hypoglycemia is Vildagliptin. As you can see in the below graph, that amongst all the DPP-4 inhibitors, Vildagliptin provides robust inhibition to DPP-4 and greater potency of lowering blood glucose level than sitagliptin, and sitagliptin thus providing superior HbA1c reduction amongst its class. Thus, in patients like Mr. Awesome with raised levels of HbA1c, treatment with Vildagliptin will help achieve the goals of reduced HbA1c. As you can see that the highest reduction is provided by Vildagliptin in this study. Now let's summarize the case for better management of hypoglycemia in diabetic patients. Hypoglycemia is the substantial barrier to the effective control of blood glucose concentrations in patients with type 1 and type 2 diabetes. Hypoglycemia can have a significant impact on morbidity and mortality, increase the length of hospital stays and healthcare costs, and negatively affect a person's ability to safely operate a motor vehicle. Physicians should assess medications. Appropriate and timely adjustments in medication may reduce the patient's risk of experiencing hypoglycemia. Coming to some major steps in reducing the risk of hypoglycemia. We must provide patient education on how to deal with hypoglycemic crisis. Patient must be guided with suitable dietary intervention to prevent glycemic excursions. Continuous glucose monitoring in patients, especially who are having diabetes from a long time. Medication adjustment, as we discussed, that in this low risk of hypoglycemia and better glycemic control could be achieved if we replace glimepiride with vildagliptin. This case scenario is taken from the American Diabetes Association's official page. This interactive video is presented to you by the manufacturers of Galvecta and Galvecta Plus.